So this is what actually I want to share with you all people, that if a simple क्या बोल सकते हैं, एक अल्पमति वैद्य मेरे जैसा एक अल्पमति वैद्य अगर ये कर सकता है, तो आप तो सभी लोग ग्रेट पर्सनालिटीज हो अपने आप में. सो स्टे विथ अस एट द till the end. I am going to share with you something which I have achieved, which I have got from my life. I want to share with you all peoples. So without wasting the time, let's start with the today's talk. So I was actually tend to share with you a case which came to me a day after yesterday, sorry, a day before yesterday. A case ऐसी थी. दिस टॉक इज गोइंग टू बी बायलिंगुअल. मैं कुछ हिंदी में बताऊंगा, कुछ इंग्लिश में, क्योंकि बहुत सारे लोग ऐसे भी जुड़े होते हैं हमारे साथ साउथ इंडिया से कि जिनको हिंदी समझने में थोड़ी दिक्कत होती है. सो आई एम गोइंग टू बी बायलिंगुअल. सो क्या होता है कि एक पेशेंट मेरे पास आई. शी वाज हैविंग अ सीवियर नी पेन और बहुत ज्यादा स्वेलिंग था. तो हमेशा से जैसे हम व्याधि वृत्तांत लेते हैं, इति वृत्तांत लेते हैं रुग्ण का, तो आई हैव गॉन थ्रू द हिस्ट्री एंड द पेशेंट वाज already visited three of the orthopedic surgeons. The last orthopedic surgeon asked her to go and take a MRI because उनका जो एक्सरे था उसमें बहुत कुछ ऐसा खास बहुत सिग्निफिकेंट एक्सरे नहीं था. Just if you will allow me, I will share with you the case on my portal. We take just a minute. So that I will be able to share reports with you. Just a minute. Second. Okay. I will share it you once I find it. It is taking some time to search. So I will tell you that story. So he had the MRI was stating that there was a meniscus tear only, and there was everything was okay. There was no considerable reduction of space into the joint, but because of some of the accidental or some traumatic reason, her meniscus got torn. But the patient was having the symptom with the severe pain in the knee while walking. The उस पेशेंट का कहना ऐसा था कि अगर वो सीढ़ियां देख भी ली, इवन इफ शी वॉचेस द स्टेयर, शी गॉट फियर्ड. वो इतनी डरती थी कि इतना जहन में उसके बैठा था, इतना जबरदस्त उसे पेन था कि अगर वो सीढ़ियां देख भी ले तो वो घबराती थी. शी वॉज टेलिंग एंड शी वॉज अनेबल ऑफ थिंकिंग दैट आई कैन क्लाइंब अ सिंगल स्टेयर. तो उसके बाद में उन्होंने एक फिजियोथेरेपिस्ट को भी विजिट किया था. और फिजियोथेरेपिस्ट को विजिट करने के बाद she got a slight result but was not satisfied because already 7-8 sittings हो चुकी थी, but the pain was not reduced up to the mark or up to the extent that she can bear it. So whenever I go through the history and I observed her, her posture, her gait, her swelling. I have done all the three basic parikshas, darshan, sparshan, and prashna pariksha. And I got to know that the patient was actually having the extracellular swelling and not the intracellular swelling. And what is the difference between the extracellular swelling and intracellular swelling, or extracellular fluid and intracellular fluid? So whenever the structure is got affected, like muscle or ligament or tendon got torn, then it swollen and it hurts. But here is the condition that it was extracellular, because when I palpate, there was a tivra sparsha sahatva. There was very much tenderness, swelling. So whenever you have seen कि जब भी फ्रैक्चर होता है तो आप लोगों ने देखा होगा कि तुरंत उस पेस में, उस जगह पे स्वेलिंग आ जाती है, सूजन आ जाती है। दो बाकी के जो स्ट्रक्चर्स है, लिगामेंट्स, टेंडन, वो अफेक्ट हुए या नहीं हुए, although they are affected or not, but if there is a simple hairline crack also, there is a massive swelling, there is obstruction, there is a lack of range of motion, जहाँ पे हम क्रिया हानि कहते हैं। तो why it is happen? Because it is a reaction of a body. It is a reaction of a body to protect that particular injured or disintegrated bone. सो ये कब होता है? तो उस वक्त पे जो स्वेलिंग होती है नॉर्मली, दैट स्वेलिंग इज द एक्स्ट्रा सेल्यूलर। और हम कैसे पहचान सकते हैं कि इट इज एक्स्ट्रा सेल्यूलर? जब भी उसको आप थोड़ा सा ट्रीटमेंट दे दो, एलिवेशन दे दो, यानी उसको थोड़ा ऊंचाई पे रख दो, तो वो सुबह तक स्वेलिंग उतर जाती है। कुछ मेडिसिन दो तो स्वेलिंग उतर जाती है। बट इफ इट वाज द इंट्रासेल्यूलर, द स्वेलिंग विल नॉट गो अवे। मैंने उसे सिंपल IASTM नाम का, इंस्ट्रूमेंट असिस्टेड सॉफ्ट टिश्यू नाम का ट्रीटमेंट किया, क्योंकि ये एक तो वहां स्वेलिंग है, आप वहां स्नेहन स्वेदन नहीं कर सकते, आप वहां जानूबस्ती नहीं कर सकते, बिकॉज ऑलरेडी देयर इज अ जल महाभूत की संचिति वहां पे है, जल संचिति है, ऑलरेडी देयर इज अ एक्यूमुलेशन ऑफ फ्लूइड इज देयर, सो यू कांट एड मोर स्नेह द्रव्य देयर। यस, यू कैन डेफिनेटली डू दी रुक्ष स्वेद, but that is not going to help, because just it is not that fast कि आप वृक्ष श्वेत कर लो और तुरंत वहां का स्वेलिंग चला जाए। So what I have done, or what I have thought of my mind, that if I will disperse this fluid, अगर मैं उस फ्लूइड को फैला दूं, तो जो टेंशन वहां की मसल्स, लिगामेंट्स और टेंडॉन्स पे आ रहा है, that will be lessen, that will be goes down, that pressure will be that reduced. So I have done the ISTM, and it was very much fortunate that she started walking, and the pain level was decreased from 10 out of 10 to 10 out of 2 only. And I have repeated the same thing today only, yesterday, and the patient was absolutely okay. But here we have to keep in mind that I have not repaired her meniscus. But why this came to me? Because of my 7-8 year experience, because of the things I have gone through, it was in very clear in my mind that because of only meniscus tear and all other structures are, if they are intact, then there will not be the obstruction in the movement. There should not be the obstruction in the movement. The obstruction in the movement is because of that extracellular fluid. So as I was able to give the relief to the patient, and I am a man who never runs behind the result. मुझे बहुत बार लोग पूछते हैं कि सर ISTF की रिजल्ट है क्या, निडलिंग के रिजल्ट है क्या, अग्निकर्म के रिजल्ट है क्या, विद्याकर्म के रिजल्ट है? एवरीथिंग हैज इट्स ओन रिजल्ट। देखिए, बहुत अच्छी बात मुझे आज हमारे एक कलीग ने, फ्रेंड ने कही कि तलवार अगर यूज करनी है किसी चीज के लिए, आपको अगर कद्दू काटना है और आप तलवार यूज करें, तो तलवार बुरी चीज नहीं है, तलवार इज नॉट द बैड वेपन, बट वी आर यूजिंग इट एट द रॉन्ग प्लेस। जहां काम चाकू से चल जाएगा, वहां से आप तलवार नहीं यूज कर सकते, या अगर आपको किसी रणभूमि में जाना है, युद्ध करना है, तो वहां आप चाकू लेके नहीं जा सकते. सो वी शुड हैव वेरी क्लियर विजन इन अवर माइंड. वी शुड बी वेरी क्लियर इन अवर माइंड that what we have to do, and for that purpose we have to do the proper diagnosis. And hence I always tell to my colleagues, I always tell to my friends who ask me about the patients, or some of the discuss about the patients, or some of the students who are coming to my OPD, I always ask them that first focus should be on the diagnosis. As we are the Vaidyas, as we are the doctors, our primary duty is to diagnose the health issue, diagnose the root cause, and then after we are able to treat the patient more proficiently. देखिए बहुत सिंपल है, बहुत सिंपल है. आपका अगर जिंदगी में व्हाई क्लियर है, चाहे वो आपकी जिंदगी हो, चाहे आपकी प्रैक्टिस हो, इफ योर व्हाई इज क्लियर, योर हाउ इज वेरी इजी. आपको अगर पता है आपको क्या करना है, तो कैसे करना है ये आपको समझ जाएगा. अगर आपको नहीं समझेगा, अगर आपको रास्ता नहीं मिलेगा, तो आप रास्ता बना दोगे. इफ यू डोंट फाइंड द वे, यू विल क्रिएट योर ओन वे. बट फॉर दैट द ओनली थिंग यू रिक्वायर इज व्हाई. सो दैट इज द थिंग. इफ यू आर examining a patient in your OPD, if you are having a patient with the pain, first you should find why the patient is having the pain. Where is the root cause of the pain? And this all things we are going to discuss very briefly in today's topic. So in today's topic is the introductory session for the master class in Ayurved Orthopedics. So here I wish to share with you a PowerPoint presentation specially designed for today, specially designed for you people. So here, Integral Endopedia's Ayurveda School Arc and Arvachin Ayurved Gurukul brings you a master class in Ayurved Orthopedics. Here I am Dr. Swapnil Gawande. Already Dr. Manjusha have given an elaborated introduction of mine, so no need to repeat it. So first of all, I call this diagnosing a pain elephant. I call this diagnosis of a pain management an elephant. So why I called it an elephant? Because when a patient comes to us with a pain condition, might be a Janu Sandhi, Janu shul, might be a Kati shul, might be a neck pain, any kind of pain, he comes to us. Then there are lots of things we are treating him that okay, if the patient comes with the X-ray, we called it okay, there are osteophytes in the Janu Sandhi. Okay, there are the osteophytes in between the bones, and hence it is paining. We called it something. There are written that there is osteoporosis. Osteoporotic bones are the patient's bones are osteoporotic. So we call okay, because of osteoporosis there is a pain. If the patient comes with the MRI and there is written that there are signal intensity of high signal intensity of the ligament or tendons, then we think of that. So, but why I called it as an elephant of the pain management, because we see only one by one structure, that we called it that it is a संधिगत कि संधिगत वात को भी ट्रीट करना है, और फिर इसकी चिकित्सा क्या है, बस्ती है, तो हम उसका जानू बस्ती करके देखते हैं. तो देन जानू बस्ती करके अगर रिलीफ नहीं आ रहा है, तो हम उसको वेदन कर्म करके देखते हैं. फिर अगर वेदन कर्म से भी रिजल्ट नहीं आता है, तो लास्ट ऑप्शन होता है कि अग्नि कर्म करके देखते हैं, और अग्नि कर्म करने से भी नहीं होता है, तो देन ऐसे कहते हैं कि रक्तमोक्षण एक आधी चिकित्सा है. जैसे बस्ती आधी चिकित्सा है, वैसे रक्तमोक्षण भी आधी चिकित्सा है. तो रक्तमोक्षण करके देख लेते हैं, बट स्टिल समटाइम्स स्टिल देयर इज अ पेन. If we will be honest with ourselves, we are just treating that pain like this, all these six blind. You know, छह अंधे हैं, इनके जैसे ही हम उस पेन को ट्रीट कर रहे हैं। कभी हमको लगता है ऑस्टियोफाइट की वजह से पेन है, कभी हमको लगता है बोन की वजह से, कभी लगता है कार्टिलेज की वजह से, कभी मसल, कभी टेंडोन। और इसी में क्या होता है कि हम खुद पर का कॉन्फिडेंस भी लूज कर देते हैं और पेशेंट भी हमारा ऊपर का कॉन्फिडेंस लूज कर देता है, एंड ही स्टार्ट सर्चिंग दी ऑप्शंस। सो हाउ टू डील विद दिस पर्टिकुलर एलिफेंट ऑफ पेन? हम इस एलिफेंट को एज अ एलिफेंट कैसे देखें, हम इस पूरे पेन को कैसे देखें कि हाउ वी विल ट्रीट द कार्टिलेज, हाउ वी आर गोइंग टू हेल्प विद द मसल रिलीज, हाउ आर वी गोइंग टू हेल्प द पेशेंट्स पेन विद द सपोर्ट एंड सपोर्ट टेंडन, how we can give the stability to the ligaments, how we can nourish the bones. So we ought to see the elephant as an elephant and not at its body part. Okay, I think that it is clear up till now. So for example, हम जानू बस्ती के बारे में या घुट्टे के बारे में ज्यादा, लो बैक पेन और नी पेन, यही दो बहुत ज्यादा केसेस है। और थर्ड नंबर पे आता है नेक पेन। तो अगर हम इस नी को देखेंगे, डिसेक्शन को, तो आप देखोगे कि हम क्या ट्रीट कर रहे हैं इसमें से। हम आईटी बैंड ट्रीट कर रहे हैं, हम पॉप्लिटियल फोसा ट्रीट कर रहे हैं, हम ग्रेटर ट्यूबोसिटी यानी बोन ट्रीट कर रहे हैं, हम डिजनरेशन ट्रीट कर रहे हैं, हम क्या ट्रीट कर रहे हैं? क्योंकि जब आप घुटनों का इसके ऊपर की स्किन निकाली हुई है और एक पार्ट होता है इस पे फेशिया, जो कि एक कनेक्टिंग टिश्यू है। तो इसमें से हम एग्जैक्टली क्या ट्रीट कर रहे हैं? क्योंकि घुटना तो इन सबसे बना है और पेन कंडीशंस, पेन का ओरिजिन इनमें से कहीं भी हो सकता है। या फिर हमारी बॉडी इंटरलिंक्ड है। हमारी बॉडी जो है, मैंने जैसे पहले भी कहा कि व्हेन देयर इज अ जस्ट अ हेयरलाइन क्रैक इन द बोन, लेकिन हमारी स्वेलिंग आ जाती है, हमारे वहां के टेंडॉन्स फूल जाते हैं, हमारी मसल स्टीफ हो जाती है। क्यों? बिकॉज इट इज अवर मैकेनिज्म, इट इज कॉल्ड एज अ पेन गेट मैकेनिज्म, कि हमारे न्यूरल बॉडी, आप सबको पता है कि वेन एवर वी टच अ हॉट प्लेट और वेन एवर अ नीडल इज pricked to us, there goes a signal, and that signal alerts our subconscious mind, our immune system, and that will send the mechanoreceptors, the nociceptors, and ask the muscle to become a stiff so that there will be no further injury. You all know that this phenomena. So that's why when we are treating, we have to reverse this process. We have to reverse this process, and therefore we have to think about all these structures. So what are the soft tissues basically involved in the injuries of any kind? That is muscles, fascias, ligaments, and tendons. These are all soft tissues. Also there are bones also there, which are the categorized as the hard tissue. But if there is a obvious fracture, if there is a obvious dislocation, first we have to do, even though in dislocations the pain is not because of the dislocation, but the pain is because of these four elements got dis distorted or disintegrated, and the pain arises. So we have to develop, we have to develop a new perspective on the person centered pain management. Every pain is different. हमारे इसमें फर्स्ट ईयर में हमें श्लोक था, पिंडे पिंडे मथर बनना, कुंभ कुंभ नय पयम। हर कुएं का पानी अलग है, हर मिट्टी की उपजाऊ अलग है, वैसे ही हमारे हर पेशेंट अलग है, उसकी हर इंजरी अलग है, उसका पेन का कंडीशन अलग है। सो देयर इज अ कॉल टू एक्शन टू ऑल आयुर्वेदा डॉक्टर्स दैट वी शुड develop our new perspective to see towards the pain. We have to develop a new vision, a vision of possibilities, a new vision of positivity towards managing the pain. So how we can achieve this? So the first thing which we can do is the myofascial release therapy. So what is myofascial release therapy? Myofascial release therapy is a type of gentle constant massage that releases the tightness and pain throughout the myofascial tissues. कोई भी इंजुरी हो, कोई भी चाहे वो फ्रैक्चर हो, चाहे वो लिगामेंट टीयर हो, चाहे वो मसल स्प्रेन हो, ऑल द फर्स्ट इम्पैक्ट जो होता है वो मायोफेशिया पे होता है। मायोफेशिया इज अ कनेक्टिंग टिश्यू जो कि 3-4 लेयर्स में हमारे मसल्स को एनरैप करता है, एक टाइप सा पैकिंग देता है। पहले तो उसकी टिश्यूज को enwrap करता है? First, the myofascia, the deep myofascia enwraps the tissue, the fiber bundles of the bundle of fibers of the muscles. Then it again collaborate, or it again enwrap the tissue bundles, and again about the each and every muscle is enwrapped with the fascia, and these all fascia, the superficial, the deep fascia, and the deep fascia is involved in the injury. So it is the first respondent of our body. So myofascial release is very important. It is also explained in the Ayurveda and the form of Marma therapy, in the form of different kinds of massage like Snehana, Abhyanga, the Mardan, the Udvartan. All these are nothing but the techniques for the myofascial therapy, but we have to think it in the modern way. We have to correlate it within the modern way. So first you will locate the trigger point or the knot in your facial tissues. How you will going to see that? By the palpation, by the simple movements, by just palpating with your hands. You are going to feel the knots, you are going to feel the trigger points. Then you have gently apply the pressure until you feel the tension. So how these you are going to see, we are going to see in later, and it has got the different techniques now. So if it is a superficial fascia, if it is a deep fascia, if it is a deep fascia, if it is a facial distortion, or it is just a facial tightness, we have to diagnose, and for that we can have the different kinds of weapon in our bag. We should have different kinds of weapons in our bag to tackle each and every kind of the, जैसा एक सैनिक, just like a soldier, he has his gun, he has his pistol, he has his kukri with his, he has grenade. Like a soldier, we should also have a different kinds of weapon in our bag. So which are these weapons? The manual soft tissue mobilization, strain counter strain technique for trigger point release, the instrument assisted soft tissue mobilization, dry and gliding techniques of the cupping. So in this picture, you can see that in the first picture, there is the ISTM, in the second, it is cupping, in the last and uh, the right last picture, the right last picture, it is a manual soft tissue mobilization or marma chikitsa. So what are the benefits of the myofascial release that will help you or help your patient? The myofascial release technique can help with the fibromyalgia condition, post-surgical condition, pelvic pain, soft scar tissue release. If you go through the old videos, if you go through the old link which has been shared in the groups time to time, you will find that I have demonstrated some of the scar tissue release, and which gives the dramatic results, which give the magical results in pain relief to the patient. Shoulder pain, abdominal surgeries, post dysfunction, chronic headaches, and there are much more than these benefits which I have listed here of the myofascial release. So the next is the dry needling. The dry needling is just an elaborated technique of the Vedhan Karma. In the Vedhan Karma, we are using the just 1 inch or half inch of the 26 bore needle, which we go up to only skin deep, or the lymphatic, on the 1 or 2 layers, or just up to the skin deep we can do. But with the dry needling, you have got the extend up to the muscles also, up to the ligaments, and sometimes up to the nerve also. So dry needling is used for the pain management, pain and movement issues also associated with the myofascial trigger points and muscle knots, which cannot be released by the just by the myofascial release or MFR or other techniques. Then dry needling helps it, because sometimes the trigger points or muscle knots becomes fibrous, and they are not released with the pressure only, the superficial pressure. At that point, we need the dry needling to release them. With this technique, we insert needles into the near trigger point or the structure related to the biomechanics, facilitating the range of motion. For example, a patient comes to you with the shoulder pain, and he was unable to raise the his shoulder above the 90 degrees. So you have to understand that there may be issue with the infraspinatus muscle, and you have, if you do the proper dry needling into the infraspinatus muscle, you will get the very instant result, because here we are going to give you the vision that every shoulder pain is not just a frozen shoulder. It may be associated with the back muscles, it may associated with the supraspinatus, infraspinatus, or rhomboid muscles. So at that point, this myofascial release dry needling helps in a great way. And in a very speedy recovery, you can go give to a patient with the shoulder surgeries after post-surgical. The needle stimulation to the muscles which cause them to the contract and twitch. So the muscles which gone into the spasm or into the myofascial tightening because of the our nociceptor to protect our further injury, this muscle twitch can give that release from that spasm, and this helps relieve pain and improve your range of motion. So this is the utility of the dry needling, or this is the function how dry needle works. So here is the pictorial representation that this is the pictorial that when we do the superficial penetration, it may go up to the subcutaneous tissue or at the up to the skin level only, because subcutaneous tissue are just beneath the skin but above the muscles. But with the help of dry needle, you can go deep. You can go deep. So in the next picture, you can see that there are different needles at different points into the knee joint to give the relief. Just quickly, we will see the benefits of dry needling. The first benefit, it is not require a big space or big infrastructure. You can do it in your OPD also. You can do it on your examination table. You just need the dry needles of different sizes for different body parts. So when dry needling is applied to an affected muscle or trigger point, it can decrease muscle tightness, increase blood flow, and reduce the pain immediately. Patients often report the immediate relief after the treatment. Dry needling is safe technique. Most of the patients, most of the participants who are following our orthopedic pain management series, which we are running from last 1 month, ask that is the dry needling safe? What if the dry needle pierce the nerve? What if it is gone into the wrong structure? What are the side effects of dry needling? But I am going to assure you that dry needling is absolutely a safe technique for treating many musculoskeletal conditions, including shoulder pain, rotator cuff, bicep tendonitis, iliotibial band syndrome, Achilles tendonitis, low back pain, and many more conditions. For wherever there are the issues with the muscle, soft tissue, dry needle is the best. And even if the dry needle touches the nerve, you don't have to bother, you don't have to be panic, because the dry needles or the needles which we use are of the very fine. The needles are so fine that we use the 26 0.26 mm, I think, bore needle for Vedan Karma, and here we are using 0.0025 mm, that is 10 times thinner than the needle we use for the Vidya Karma or Vedan Karma. 10 times thinner than that, and they are the solid needles, they don't have any bore, so they don't make any harm to the nerve, or don't harm any other anatomical structure in the body. So they are very safe. Then osteopathic articulation techniques are there. The osteopathic articulation refers to the mobilization and manipulation of the joints through the process accused. So more than is implied by that statement. So for example, in short, the osteopathic articulation refer to the mobilization and manipulation of the joints. जो हमें लगता है कि हम फॉर एग्जाम्पल अगर रिस्ट पेन है और हम उसे थोड़ा सा आर्टिपेलिक आर्टिकुलेशन देंगे तो वो थोड़ा फ्री हो जाएगा, इट डजंट वर्क ओनली दैट लिमिटेड, उससे भी कहीं ज्यादा वो उसके लिए काम करता है, बिकॉज इट इज सेंडिंग द मैसेज टू ब्रेन दैट दिस कैन बी मूव्ड विदाउट हार्म, एंड योर ओन हीलिंग power, your own pain gate mechanism will help the injury to recover. It can be used to treat the wide range of affiliations of the pain, including musculoskeletal pain, hypertonic muscles, osteoarthritic joint changes और डिक्रीज रेंज ऑफ मूवमेंट्स। जैसा बहुत बार आपके साथ हुआ होगा कि पेशेंट चलते चलते, या बहुत बार आपके पास ऐसे पेशेंट्स आते हो कि कुछ नहीं डॉक्टर साहब, एक बकेट उठा लियो तब से कमर में स्पैजम आ गया, मैं सीधा ही नहीं हो पा रहा हूँ, एक्यूट जो है उनका रेंज ऑफ मोशन कम हो गया या सीवियर पेन है, उसमें अगर आप थोड़ा सा ऑस्टियोपैथिक आर्टिकुलेशन दे दो तो इट इज वेरी इजी एंड इट मे हेल्प इन रिलीजिंग द ऑब्स्ट्रक्शन इन रेंज ऑफ मोशन। Also, osteopathic articulation can restore the movement and decrease the pain to affected joints by use of slow, low-key manipulation to the problem zone, working within your pain-free range of the motion so as not to cause further discomfort. इस स्टेटमेंट का मतलब एकदम सिंपल है, जैसे मैंने अभी बताया कि अगर रिस्ट पे पेन है और आप जहां पे मूव नहीं, जहां पे दर्द नहीं हो रहा है, उस रेंज में भी अगर आप मूवमेंट देते हो, स्लो मूवमेंट अगर आप आपके उसको दे रहे हो, तो धीरे धीरे इट विल स्टार्ट रिलीजिंग दैट स्पैजम, इट विल स्टार्ट रिड्यूसिंग द पेन, एंड इट विल start sending the message to your subconscious mind that okay, this part is now being restored. So we'll just see an example of it. So this is the case of 60-year-old female. In the first picture you can see that there is a straightening of the spine. In this x-ray you can see that there is a straightening of the point, also there is a loss of height into the L1 space, and because of this loss of lumbar lordosis, because of the straightening in the spine, this is commonly happens because of the acute spasm into the paraspinal muscles like spinous erectus and multifidus muscles, the deep skeletal muscles, because of the spasm into the deep skeletal muscles because of wrong motion. For example, एकदम से झुक गए और उठते वक्त या कोई भारी चीज उठा ली, उस वक्त इस टाइप के स्पैजम आते हैं। मोस्ट ऑफ द टाइम द क्रॉनिक स्पैजम इनटू द lumbar muscles causes the straightening of the spine. So in this particular video, the video I have made it very short to save the time, you can see that I am giving the osteopathic articulation so that the spasm will be released and the movement will be restored. So this is how we can do the simple, just you have to follow the principles of the osteopathy articulation. You just have to have the good knowledge of anatomical structures, anatomical functional anatomy of that particular part which you are going to articulate. And also there are different kind of cupping we are going to cover in this master class, like dry cupping, wet cupping, fire cupping, and the dynamic cupping. All other cuppings you may have heard, but lots of people ask about what is dynamic cupping. So in this video you can see the use of dynamic cupping. Here is an athlete with the hamstring stretch, severe hamstring stretch, and for him I am giving the articulation with the dynamic cupping. So this dynamic cupping is releasing the stretch, the spasm on the hamstring muscles, also releasing the myofascial distortion which has been happened because of the overuse injury or the chronic injury because of as he is a professional athlete, as because of the overburden, overstress on that particular muscle, it has become swollen, it has become stretched out, and this kind of dynamic cupping can help you. But here also you have to have the good knowledge about the muscle muscle movements, muscle function, and you have to decide that where you have to give the particular stress, where you have to fix the cup, and how the articulation you have to give the particular for particular injury. So the potential benefits of the cupping therapy, the different cupping therapies which we have discussed, that reduce pain and inflammation, decrease muscle tightness, improves blood flow, increase range of motion, also gives benefit which are explained in our granthas. Like it also gives the effect of Ghati Yantra. It also can be used for the Rakta Mokshan with the help of weight cupping. Also in the Mardan, where there is a need of Mardan or deep myofascial release or deep tissue release, wherever you need a deep tissue release, you can use the cup gliding method of the cup, where you can apply oil and glide the cup along with the anatomical structure which is being affected. So these all techniques are going to help to reduce the stress, to reduce the pressure on the soft tissues. Also, there are you can innovate the panchakarma and upakarmas with the modern things, just like into the right picture of your screen. You can see that it is for the demonstration. Actually, it was the picture just for this today's uh, webinar we have taken. This was after the Jalu Basti, but you can understand we have attached the below knee traction and we can pour the oil into the this. So we called it as a traction Janubasti. So what it do the two things. Because of this, what happens? One thing, there is a एक space तैयार होगा दोनों joints के बीच में, दोनों knees के बीच में, यानी फीमर और टिबियल लेट के बीच में स्पेस तैयार होगा, जिससे कि अगर वहां पे मिस अलाइनमेंट हुआ है नी जॉइंट का, तो मिस अलाइनमेंट भी ठीक होगा. एंड ऑल्सो you are doing the Avgaha Swed. So with the traction, if you give the Swedan, it gives a brilliant result in osteoarthritic conditions. Here in this picture or this video, actually this is, you can see that we are giving the laser light. This is the apparatus with which emits the laser rays with the Janubasti, which is act as a deep penetrating Swedan along with the Avgaha Swed. So this kind of innovative Panchakarma and Upakarma we have developed in our practice since last 8 years. So all this, along with all these factors which you have seen up till now, the modern techniques of the, just a second. All these modern techniques, we are going to cover the functional anatomy. As I have said, that you must be well versed, well equipped with the functional anatomy, that which muscles do which range of motion, which muscle is important while giving the remote movement. For example, in tennis elbow, the extensor muscles of the forearm are very important. If you treat only tennis elbow and you don't treat the muscles associated with it, it will be again revert back, and the pain will come back after some time. So you must be well versed with the functional anatomy. We are going to cover the functional anatomy of each and every joint. Then the diagnosis, the clinical, radiological and pathological diagnosis. We are going to cover in this course the how to diagnose clinically, radiologically and pathology, and how to integrate, how to make a common diagnosis out of these modalities. Then we are also going to discuss about the Marma Chikitsa, the 4 techniques to do the Marma, like Anchan, Pidan, Vimlapan. Then Bandha Chikitsa, we are going to discuss about the bandaging techniques. As you know that in the acute injury, the first line of treatment is to stabilize. So how can you stabilize? According to the modern science, according to the Ayurved science, there are different kinds like crepe bandaging, then the sports taping, the hard taping, then the Shotharlap, Shulharlap lap, and the Sandanak lap, and how we can do the therapeutic taping for correction of the certain kind of postures we are going to cover. Also, we are going to discuss about the utility of the Agni Karma and Vedan Karma, that when to use Agni Karma, where to use Vedan Karma, so that we can be very precise, while selecting the modalities. यानी अगर हमें किसी एक युद्ध करना है उस दर्द के साथ, हमारे पेशेंट के साथ, अगर हमें उस दर्द के साथ, तो कौन सा हथियार हमें कब यूज करना है, दैट विल गिव योर प्रैक्टिस एंड डिफरेंट एज, एक बहुत बड़ा स्ट्रॉन्ग एज आपकी प्रैक्टिस को देखेगा, दैट विल promote you, that will make you more confident, and that will make you more authentic, more reliable. So what we are actually going to learn for pain management, you can learn and use these pain management techniques like for first, as I have said, that functional anatomy, diagnosis, bandha chikitsa, agni karma, vedan karma, cupping, all kinds of dry, wet and fire cupping, also innovative panchakarma, posture corrections, myofascial release, gambhir vedan, that is dry needling, trigger point therapy, osteopathic articulation of spine and joints, instrument assisted soft tissue mobilization, muscle energy techniques, that is for the rehab protocols, as we call that apunarbhav chikitsa. So in manual medicine, muscle energy techniques are very good tool for the apunarbhav, because once you have restored the range of motion, once you have done the bruhan, the next duty of an physician is to strengthen that particular anatomical structure. उस particular part को मजबूत बनाना, उसमें वही पुराने वाली strength लाना, ये हमारे लिए important बन जाता है. So this is all these kind of things we are going to collaborate, जो कि मैंने all हमने एक कोर्स में एज अ बंडल ऑफ दीज ऑल टेक्निक्स वी हैव ब्रॉट इनटू द मास्टर क्लास इन आयुर्वेदिक ऑर्थोपेडिक्स, जो कि एक 6 मंथ कॉम्प्रिहेंसिव ऑर्थोपेडिक कोर्स फॉर एक्सक्लूसिवली फॉर द आयुर्वेदा डॉक्टर्स है, विच वी हैव द विजन, हमारा विजन है कि वी हैव टू एम्पावर, वी हैव टू इक्विप आवर ऑल आयुर्वेदा डॉक्टर्स विथ these kind of weapons which are been there in bag, so that they can use each and every weapon very efficiently to tackle any kind of pain in their OPDs, in their clinics, and which will make them ultimate pain warrior. So the module is going like, I am going to answer in the last, sir, I will answer your question. Just let me finish. The last 5 minute presentation is remaining. So the module, we are going here module by module. So in the first module, we are going with the introduction, general anatomy, the anatomy of the Saptadhatu and Kala. That is Astidhara Kala, Mansdhara Kala, Rasdhara Kala, Mansdhara Kala. That is how these are contributing into our pain management. Also, we are going to see the functional anatomy of spine and joints. So in first module, we are going to see all the basic knowledge. Into the second, we are going to see the pain gate mechanism. The pain gate mechanism is the mechanism, is a theory of a mechanism, that how a pain, because you all know that, or if you are not knowing that, I will tell you, or I will give you a new vision of looking towards the pain. The pain is a perception and not a sign or symptom. Because if I am telling I am having a shoulder pain, only you have to believe on my words. You don't have any kind of tool that you can go and see that is there a pain real, how is the severity of the pain. Because if the two people which have got or which are been hitted with the at the shoulder at the same instant, but the pain level of the two other people will be different. If a person made with the same accident, two person with made the same accident with the same intensity, but the level of the pain will be different. because the pain is a perception and it changes from person to person, patient to patient. So how this pain gateway mechanism works with our uh, in also we are going to see what is the psychosomatic connection of the pain. Also we are going to see the samanya vichar of the Ayurveda Vat Chikitsa, Vatrok samanya viched chikitsa siddhant, that how we can go the dhatu wise chikitsa, dosh wise chikitsa, and again there are what are the other modalities, like there are some Kulaj Vyadi, there are some Atmas Vyadi, there are some Samanya Vyadi. So we are going to see that in different modalities how this Vatrok Samasya or Vatrok Chikitsa should be done. In the third module, we are going to see the clinical diagnosis, postural analysis, radiological analysis, and pathological analysis, that how clinically we, what should we see, how should we examine the patient, what should be our protocol of checking the patient, of examining the patient, how should we can see the radiological, which are the radiological signs and which are the radiological landmarks we have to focus on while examining or while going through a radiological report. Also, what are the significance of the pathological report, that what CVC suggests, what other reports suggest about the pathological, about that particular pain conditions, what are their significance in our treatment, in significance in choice of drugs. Again, in the fourth module, we are going to see how to set the Panchakarma protocols, how are the regular Upakarmas can be protocolized, or you can make the protocol that which Upakarma or which Panchakarma should be first and which should be in the last. Also, as I have shown the modified Upakarma, I am going to share with you. Then Agni Karma and Vedan Karma also we are going to discuss in this module. In the fifth module, we are going to see the all kind of cupping, then the Bandha Chikitsa, kinesiology taping, and the myofascial release. Uh, that continuing into the sixth module, we are going to see the different things of myofascial release. We are going to look myofascial release into the module 5. In module 6, we are actually seeing the techniques that how actually we can do it, like a trigger point, Marma Chikitsa, osteopathic articulation, and soft tissue mobilization techniques. From the seventh module up to the ninth module or 10th module, I think, 10th module, we are going to see segment by segment, like cervical spine, thoracic spine, lumbar spine, pelvic girdle, shoulder. In this, we are going to see the how we can diagnose the pain at that particular joint. Then what is we are also going to understand the functional anatomy, the muscle and other structures, the ligaments, tendons, which are related to that joint, and how we can diagnose or understand that from where the pain is rising. The ankle joints in model 10, we are going to see about the special condition like rheumatism, the different kind of rheumatism, the post-viral arthralgia, the rheumatoid arthritis, the some of the arthritic conditions which are called as the seronegative RA or the seronegative rheumatoid arthritis. In the second part of the 10th module, we are going to see the ankylosis of the spine, ankylosis of these other joints. What is the ankylosis? Actually, the concept is, and in both the in rheumatism, in ankylosis, we are going to discuss both the modern and Ayurvedic point of view. Also, we are going to see the treatment options which are available, and also in module 11, we are going to discuss with the some of the special conditions, special pain conditions, like post-surgical, pre-surgical rehabilitation, post-surgical rehabilitation, the scar tissue problems, or the psychosomatic pain disorders. We are going to see how to diagnose them in the modern and Ayurved way, and how are the treatment modalities. And in the last but not the least, 12th module, we are going to see the diet and nutrition, how should we manage the diet and nutrition, and also we are going to share some of the yoga techniques, some of the generalized yoga session for the rehab and the Apunarvo. Also, there one thing is missing into module 12. We are also going to do the MET cover. We are also going to covering there the muscle energy techniques there. So this is me as Dr. Manjusha has already, but who have joined late. I am the founder and chief consultant of Spine and Joint Care Center at Ayurved Multispecialty Ayurved Hospital, Akola. I am also an honorary medical officer at Shiv Chhatrapati Kridapit, Pune. It's Krida Prabodhini at Akola. It's a institute for the boxers all over Maharashtra who plays national, international for our country and for our state. Also, I am the founder of Ayurved Integrated Sport Rehabilitation and Training Academy and Arvachin Ayurved Gurukul. So, friends, all these knowledge I have gained from all these great leaders of the world. I will not take each and everybody's name, but these all are wonderful teachers. They have shared their knowledge from the bottom of the heart. If you wish, you can go to anybody of them and you can have thorough knowledge. Each one of them is specialized in each one field, just like uh, in the first picture is the Dr. Kostas Rizopoulos. He is expertise in the trigger point release and the manual therapies. Then Dr. Tom Mayer from Belgium. Dr. Costas is from USA. Dr. Tom Mayer was from Belgium, and he is a very versed and very philosophical teacher who is expertise in restoring your autonomic nervous system. How you can release the pain, how you can restore the pain by working on autonomous nervous system. In the middle is Dr. J. Amata, my professor and my principal of Palms Osteopathic College, Osaka, Japan, under whose able leadership and guidance, I have completed my 3-year diploma in osteopathic manipulative practice from Japan Health Association. All other Guild Gair, where I learned the chiropractic, osteopathy, and ISTM. He is one of the leading trainer in the world. Dr. Jad Wehebe, where I also learned the psychosomatic and mindfulness techniques to release the pain. Here are Dr. Thorsten Fischer from Germany, who taught me the myofascial release, the facial distortion module. The well-known, the star NLP trainer of India, Dr. Ram Verma, Dr. Dharmesh Kubendriyan, and Dr. Arshad from Kerala. He taught me how to integrate all these techniques. And Dr. Kostopoulos, he is also from the USA. All these courses cost me or took me 6 long years to learn everything which I have shared today with you, and cost around 20 to 25 lakhs. I have not never measured that knowledge into the money, but for the sake of your understanding, and this all, if I'm going to teach you, if I'm going to share all this knowledge, I will probably approximately this cost is 20 lakh. So you can guess, or you can, and my 8-year long experience is added to it. So if anybody asks me that how much you will charge, I may have said 2 or 3 lakhs rupees for a student, but for as I have a vision in my life, my guru has said me that you are the flag holder of the Ayurveda and you have to build a community, and with his grace, with his directions, I'm just offering this course at only 10% of its cost to me. That is only 20,000 rupees. But if you are an action taker and if you are really interested, if you are really if you really want to excel yourself, you can take the action within 24 hours, and this course will be for only 15,000 to you. If you will register within 24 hours, because we have already our quota full. This is the last lecture, I think, for the or this is the last time we are giving this offer to you. This is only 15,000. You can register by paying only 3,000 to book your seat, and you have to pay it before 6th of July, because from 8th of July we are starting our course. So This is all from my side. Sorry, there is one more mega bonus. I think there are only 3 or 4 slots are remaining for it because we are already packed with the admissions. 2 days offline workshop for your query session, for your hands-on training, for all the queries, which will be held at my own center in Akola. Or if you are ready with the 10 or 15 people group, we can arrange it at your place also at no extra cost. So worth 15,000, 2 days workshop we are giving freely with food. For first admission, 50 admissions, I think that Dr. Manjusha and Dr. Lalit will let us know that how many seats are now remaining, because I think that they are already full. So this is all from my side. I think that you should take an action and take a step towards your bright future. So thank you very much. So your dedication will bring you the perfection. Your perfection will bring your performance, and your performance bring your success. That is what is addressed by Jasprit Bumrah by his action in our World Cup. So we are champions. We will be champion in our field. We have the chance to make our field, our Ayurveda, proud in the field of medical practice. So thank you, friends, for listening to me, for having patience. So if you want to more details, if you want to contact for the course, regarding the course, you can contact on this number. You can text message, you can message on these particular numbers. I am going to unmute you all. I am going to unmute you all. If anybody have a question, they can unmute themselves and ask a question, or you can put your question. You can put your question into the chat bot. I am here for some time to answer your all the queries. Also, I will request Dr. Lalit and Dr. Manjusha. You can unmute yourself, and if you want to add something, you can add here. So you can take the screenshot of these numbers. Also, this is the payment details on which you can make the payment. Is there any certificate? Definitely there will be a certificate on the completion of the course. Okay, so somebody asked, sir, इसमें chiropractic का knowledge भी मिलेगा क्या? Okay, you will get the overview knowledge of the chiropractic, but chiropractic ये completely hands-on workshop होता है. If you people want to learn, if there is a group of 10, or if जो हम 2 दिन का वर्कशॉप रखने वाले हैं, उसके बाद अगर कोई इंटरेस्टेड है, तो वी आर गोइंग टू arrange, we can arrange the 2 days separate workshop for chiropractic, but the fees will be alag. Language of this course will be the bilingual, same as in today's lecture. दोनों लैंग्वेज में हम बात करेंगे, हिंदी और इंग्लिश, so that everybody will be proper understanding. I hope कि सबने screenshots ले लिए होंगे. Who can see your?
Hello.
Yes, sir.